let me just double check. Why don't we go ahead and get started? So thank everyone for joining us today. This is our monthly TDH Informatics Community of Practice. My name is Erin Holt-Coyne. I'm our Chief Public Health Informatics Officer and within the Office of Informatics and Analytics. And today we are very excited to have some speakers with us today from the Sequoia Project, who are going to talk with us today about TEFCA, the Trusted Exchange Framework and Common Agreement. What I'd like to do is briefly introduce our speakers and then turn it over to them. They'll talk to us a bit about TEFCA and their role, and they have a nice slide set prepared. And then if there's any time at the end, maybe we can entertain some questions. Does that work?
That's great.
Okay. And Debbie and Chantal, just for awareness, so our informatics community of practice is a relatively informal group. It's made up of informatics minded folks from around the department. Today we actually have we've invited several other folks from around the department to listen in who might have an interest as well. So like I said, relatively informal, all kind of have an informatics kind of slant to our roles and responsibilities. And so just really excited to have you guys here today. So let me go ahead and dive into the bios of our speakers. So with us today, we have Debbie Condry, who has over 34 years of experience in health information, or excuse me, information technology, primarily in the Virginia state government. Last 12 years of her career were spent as the Chief Information Officer with the Virginia Department of Health, some of our colleagues, where she was responsible for a wide variety of programs pertaining to health information technology solutions, both internal to the Department of Health and throughout the state of Virginia. In 2019, she retired from the state and joined the Sequoia Project as the Chief Information Officer and the Chief Information Security Officer. The Sequoia Project's mission is to advance health information technology interoperability for the public good, which aligns perfectly with Debbie's heart for public service and providing health information technology services to citizens to enhance patient outcomes. In 2021, Debbie was also promoted to Chief Operations Officer position. And at Sequoia, Debbie is responsible for managing and overseeing all IT-related projects and works closely with eHealth Exchange and Care Quality. As the COO, she is responsible for all operations. She's the primary point of contact for the Sequoia Project for public health related programs and work groups, including the Emergency Preparedness Information Work Group. And finally, she serves on several boards, including the eHealth Exchange Board of Directors and the Connect Virginia HIE Virginia Health Information Board of Directors. Also with us today, we have Chantal Warzala, who is the principal at Alzaro Consulting and leads stakeholder outreach for the Sequoia Project's activities as the ONC recognized coordinating entity for TEFCA. An experienced policy expert, she helped provide organizations, associations, technology companies, and patient advocates and advocates to navigate health policy as well as transform health and healthcare using digital health tools. She previously served as vice president at the American Hospital Association, where she was recognized as a leading voice for the provider community on meaningful use, interoperability, telehealth, and other digital health policy issues. Chantal also worked with the Medicare Payment Advisory Commission, and she holds a PhD from Johns Hopkins School of Public Health and an MPA from the Woodrow Wilson School at Princeton University. Thank you both so much for joining us today. We are extremely grateful and very excited to learn more about TEFCA and your organization's role.
Great. Debbie, do you want to just give a few welcome comments, just given your link to public health?
Sure. And I did want to just mention after, Erin, thank you for going through the bios, just mention for clarity's sake that I am actually not part of the recognized coordinating entity. I am the public health point of contact. So just to put some separation and some clarity there, because I'm oversee operations and IT, and for all three companies. I'm separated from the recognized coordinating entity. But when we do have topics around public health and TEFCA, I will often speak to those or assist in speaking to those like we are today. And I just wanted to clarify that really quickly. But I wanted to thank you all for having us today. Chantal and I are really excited to speak to you. I do help facilitate the Emergency Preparedness Information Work Group, as you all mentioned. I did want to mention to y'all too that we have renamed that and sort of chartered our work group earlier this year, and we are now just called the Public Health Work Group. And we have public health experts and subject matter experts from across the country who are part of that work group. So I just wanted to mention that to you all. If there is, once we finish the presentation today, if there's any interest, I'll talk a little bit about the work group, a little bit more about the work group later, but if there's any interest in participating in that work group, we have some interesting things going on and educational pieces going on there around TEFCA and public health as well. But as you know, because I came from public health, my experience is at least the latter part of my career, the experience that I had at the Department of Health, I bring that to the table here at Sequoia. So happy that you all express interest in learning about TEFCA, and thank you all again for having us today. I really appreciate it. I think organizationally, we're going to start off with Chantal, sort of doing a bit of an overview, and then she'll pass it off to me. So thank you again, Chantal.
Great, thanks, Debbie. And it really is a pleasure to be here. I think this is a well-timed conversation, just in the way that TEFCA is starting to come online. I do want to note that this is something done under contract with HHS. However, everything we say is from the point of view of the Sequoia Project and not the US government. This deck has a lot of slides, and I will go through much of the beginning material at a very quick pace. If folks want to interrupt me and ask questions, please do so. We wanted to give you a sort of meaty deck, if you will, as a reference. So I will go through it quickly, but we want to get to the public health considerations because I know that that's probably nearest and dearest to your hearts. So why do we need TEFCA? I'll start there and then go through some of the core components of TEFCA. Then I'll turn it over to Debbie to really dial in on some of the more technical aspects and get us quickly to the considerations for public health. So TEFCA has been thought about at a policy level for quite some time. It was the 21st Century Cures Act that made it a national priority and a statutory obligation of HHS. And so the idea is to create a trusted exchange framework that is based on a common agreement to allow network-to-network exchange of health information. And there was an observation made that there's a real proliferation of agreement to support health information exchange that limits where information can go and also just creates a lot of friction. And so the goal of TEFCA is to simplify exchange. We definitely saw during the pandemic that our exchange capabilities are not up to the task when it comes to sharing data to ensure the public's health. So there are really three goals, and these are the goals that have been enunciated by Mickey Tripathi, who's the National Coordinator for Health IT. The first goal is to establish a universal governance, policy, and technical floor for nationwide exchange. Second goal is to simplify connectivity so that more entities can engage in exchange. And then the third goal is really facing individuals and supporting their ability to gather all of their healthcare information in one place. And so there are lots of different benefits for TEFCA, and we actually do have a fact sheet specific to public health and state governments if you want to take a look at that, which was actually informed by a range of interviews that Debbie and I did across public health departments. So you can take a look at that if you're interested. But it is really about creating more efficiency and fluidity in the sharing of health information. So how is this going to work? It's a nice idea, network to network exchange. We're cognizant of the fact that entities have been working to create information exchange for over a decade now. And the idea here is really to create a set of rules of the road so that people don't have to create their own rules of the road. And so the Sequoia project, as the recognized coordinating entity, really has an oversight role and a coordination role. The RCE works very closely with ONC on policy. It is ONC that has the ultimate say on policy and some of the governance requirements. The core of TEFCA-based exchange are these really high volume, high performing, qualified health information networks. And the idea is that they can support millions of transactions per day and become a little bit like the cell carriers, right? So they're at the core, doing a lot of information exchange on behalf of their participants, which could be a state health department, it could be a Medicaid program, it could be a public health entity. And so really the participants and sub-participants are those who are looking to share data, and the QHINs are really this core infrastructure to facilitate that exchange. And here's the role of the RCE. So really the oversight role is to make sure that the QHINs are fulfilling their obligations. And the common agreement itself has a first version that is available for anyone to look at. It's on the Sequoia Project website. So that has been put forward, gone through lots of public comment, approval by ONC. It is a living document, so you may see changes, but it really sets out the privacy requirements, the security requirements, the purposes for exchange. So that's really the core policy document. And then there is a technical framework, the QHIN technical framework, that says how data will be shared among the QHINs. And then the role of the RCE is to be that interface to the community to make sure that anything that's done is workable. And the Sequoia project, the Sequoia project is committed to that. Go ahead.
I'm so sorry to interrupt you. Are you advancing your slides?
I am. Are you not seeing it?
No, ma'am.
That's interesting. Okay. Let me stop sharing and share again. It told me you could see it, but let's try again. How about now?
Yes, we're seeing the role of the RCE.
Okay, I'm going to go to the next slide and you can tell me. Are you seeing that?
Yes. Yep, that's
a different
the role of the QHIN. Yep.
Okay. Okay, I'm so sorry. I wonder why that happened. Just speak up, Erin, if you lose the slides again.
Will do, thanks.
So really, again, the QHINs are the core of the exchange, and they're high volume, high reliability. They are the ones that sign this common agreement that is in fact a legal document between QHINs and the RCE, and they are the ones that are expected to follow the QHIN technical framework. They then flow down some of those requirements through legal agreements to their participants and sub-participants. They are not allowed to charge fees to one another, the QHINs. However, the common agreement is actually silent on what fees a QHIN might charge their participants. And so here's a bit of a slide on what does that mean for a QHIN to flow down. What it really means is anyone who signs on to be part of TEFCA Exchange agrees to cooperate and not discriminate. They will share all data that they hold that others are legally allowed to receive. There is something special there, I want to note, for public health agencies and state governments, where you have a carve out where you can, make your own determination of what you will share. And then there are requirements around use of the directory service, what will be kept confidential, how you will update the directory, and lots of privacy and security requirements. So the TEFCA components include the Trusted Exchange Framework, which are really principles put forward by ONC, this legal document, common agreement, the standard operating procedures, which are really more detailed outline of how to achieve the objectives in the common agreement. So what data are you expected to share, for example, for treatment? Or how exactly will public health purposes be achieved? That's something that's still being drafted, and we hope you will help support those efforts. Debbie will get to that in a minute. The technical framework, right now, the RCE is engaged in onboarding the QHINs, so going through the testing process, going through the vetting to make sure they actually have the capabilities to serve as a QHIN. We will be gathering metrics as the TEFCA exchange comes online to make sure things are going well. And there will be a very inclusive governance process. So again, the Trusted Exchange Framework, you can find this on ONC's website. It's really setting forward the principles that underlie nationwide health information exchange. The common agreement has the specifics. There is a resource on the RCE website, if you want to look at it, that talks about what pieces of the common agreement will flow down to other participants. So those would be the things that, for example, a state government agency that chooses to be part of TEFCA Exchange, those are the requirements that would flow down to them. So that's something that as folks think about whether or not they want to participate in exchange, they might want to refer to that document. The standard operating procedures, again, are the bridge between what's in the common agreement and actually standing up exchange. And they speak to everything from how governance will function to what are the requirements of QHINs for cybersecurity insurance, how will treatment work, how will payment and healthcare operations work, and again, thinking through how will public health information exchange work. So the technical framework is really the nuts and bolts of how the zeros and ones fit together for exchange. And the QTF is actually about how the QHINs will share information with each other. It is anticipated that the QHINs may well provide some sort of translational services, if you will, if their participants are not ready to share information precisely in the way that the QTF requires. A QHIN can serve to do transformations and other kinds of supports for their participants so that the data is in the right format to be exchanged in accordance with the QHIN technical frameworks. And so this is really about what does it take to become a QHIN. I'm going to go right past that in the interest of time. But I want to point out that the governing approach does allow for participation by those who are participants and sub-participants. And there will also be advisory groups specific to certain use cases. So this is being built out now. But is something that we want folks to know will be there to ensure that everyone's viewpoints are heard in the governance approach. So privacy and security, this is a exchange infrastructure that will have strong privacy protections. It is built from the HIPAA privacy and security requirements. And it actually does require that, for example, those who are supporting individual access services, many of those entities may well be non-HIPAA entities. However, the common agreement and the flow down provisions will require all participants in TEFCA, whether or not they are HIPAA covered entities, to treat TEFCA information in substantially the same manner as HIPAA covered entities protect PHI. So this is leveling up, if you will, the privacy requirements so that everyone is playing by the same rules, which are really built off of the HIPAA requirements. And so that's the privacy side. Then on the security side, there is a higher bar for the QHINs who have that central role than for participants and sub-participants. But everyone involved in TEFCA exchange will essentially be required to comply with the HIPAA security rule and will in fact be expected in addition to give notice of security incidents. So the idea here is to really make sure that we have the privacy and security requirements in place, those protections, so that everyone feels comfortable engaging in TEFCA exchange. I think this is an important slide for state governments and public health so that everyone understands that TEFCA is voluntary and it does function within the constraints of applicable law. So all state, local, tribal, and federal laws still apply. And if there's a conflict between your state law and a provision of the common agreement, your state law takes precedence. So essentially applicable law comes first, then the common agreement, then the QHIN technical framework. But I know a lot of public health entities have been concerned about, well, wait a minute, we have our state laws. And in fact, those state laws do govern the sharing of information through TEFCA as it relates to exchange within your state. So at this point, I think I'm going to turn it over to Debbie, and I don't know if we want to stop to see if there are any questions here or just keep going. I'll leave that up to you, Debbie.
Let's see, do we have any overarching questions so far? Maybe drop them in the chat and perhaps we'll keep going and see what we have when we finish up. Does that sound okay to everybody?
Yeah, that works. Thank you.
Okay. All right. Thank you so much, Chantal. So I'm going to talk a little bit about the technical aspects of TEFCA. And I wanted to mention, just touch on a couple things that Chantal just spoke about as well. I hope you all can hear me okay, because my headset died this morning. So I'm just using my computer microphone for this. So hopefully you can hear okay. So I know that with state government, as Chantal mentioned, with the privacy and the security piece of aspect with HIPAA protected or HIPAA covered or not covered. One of the things I'm going to talk about in a few minutes sort of speaks to that, but I know that's a sort of an interesting topic in health departments and state government, since many state health departments are hybrid entities of HIPAA. So some covered, some not. But to Chantal's point, I think this is really important to point out. When you're participating in TEFCA and exchanging data, you are expected to reach that higher bar of protected HIPAA information, even if you are not a covered entity within HIPAA. I also wanted to point out again one of the things that Chantal mentioned, and that was the fact that participating in TEFCA is voluntary. So for public health, just like every other use cases, it is voluntary, although it does bring some really interesting use cases to the table, which could result in access to additional data and so forth. So want to speak to that in just a couple of minutes as well. So I'll start with some of the technical aspects of TEFCA. If you, Chantal, if you just want to kind of go to the next slide as I'm speaking, that'd be great. All right, so there are several components of a QHIN technical framework that support data exchange. And we're going to talk in a few minutes more specifically about public health. This is sort of a general slide to sort of discuss the overall technical framework of a QHIN. And keep in mind that, and we'll get into more of this later too, but keep in mind that a qualified health information network are those high-level sort of national networks that really have an elevated bar in terms of security, governance, the way they manage their data, et cetera. They really have a higher bar to attest to. In terms of the security piece, as Chantal just mentioned, there is a requirement within the QTF that to become a QHIN, there's a very much an elevated level of security, like a high trust accreditation or certification of something of that nature. So elevated security and privacy is really key. And for public health, that's obviously very important. So within this technical framework and the way QHINs will connect to one another, QHINs will have what's called, and Chantal mentioned this, participants, which are those who connect directly to a QHIN, and then the participants might have sub-participants, which connect to the participants, and then the participants connect to the QHIN. So within this network, then there are these supported information flows, which include patient discovery, could query for documents, and do message delivery. Then we really call it query and push. And I know in public health in particular, you're mostly a push, used to the push format where information is pushed to you that is required by state law for public health reporting, et cetera. And then there's query, which some state health departments do as well. You may be doing some bi-directional exchange of immunization data, for instance, or maybe your vital records data. But the data exchanged through query is exchanged in a CCDA 2.1 format, and that is including US CDI. And I think some state health departments are at the CCDA level with their health information exchanges, for instance, and using HL7 for sure. So functions and technology to support this exchange. There's a certificate policy, mutual QHIN server authentication, all of these pieces of technology that must be in place in order to become a QHIN and attest to all of these functions and technology and support systems being in place. So the approach here is certainly to build from current capabilities and then keep an eye toward the future. So those are the larger sort of components of technology from the QTF. All right, so exchange modalities. I mentioned this just a second ago. So there's query and there's message delivery or push. Query would be, obviously, here's a good example. I know when during COVID, public health departments were actually chatting with us about it's really difficult to query for a specific patient or query for the additional information might need about a patient, demographic information, et cetera, et cetera. So the query piece is where you can actually search for that particular patient, documents, or document retrieve. Message delivery is more of the push side of the house, where that public health is more used to than the query piece. Entities within a QHIN network, and I think this note is pretty important, must respond to queries for the exchange purpose. And again, as Chantal mentioned, that must be in accordance with the common agreement, but applicable law within your state takes precedent. So if there's something that is in conflict with common agreement and applicable law, again, applicable law takes precedent. All right, next slide. All right, so as I mentioned, USCDI, HL7, CCDA, those are probably all standards and terminologies that are familiar to you all in public health. And as you know, FHIR, which is has really taken off or been on fire. We are looking at a FHIR roadmap for TEFCA. So, and the goal is to move the transactions to FHIR in order to have more speed there, more efficiencies, more security, et cetera, around how we do transactions within from QHIN to QHIN. There is a FHIR roadmap for TEFCA, which has been published, and I think we have a link to it in this slide deck. So if you want to take a look at that, please do. There are some stages within TEFCA that we're looking at. We've started with phase 1, which is the FHIR content support. So we have some work going on there. Stage 2 is when we move to FHIR exchange or network facilitated FHIR exchange, and this is an option under TEFCA. And then network brokered FHIR exchange, which is required. The QHIN facilitated FHIR-based exchange is required under TEFCA, and then the FHIR API would be optionally available. So we're looking at both brokered, QHIN brokered, and facilitated FHIR exchange. As we start to implement TEFCA, the plan is to implement, QHINs will come on board as they're onboarded, and we have several applicant QHINs in that process now. They will come on board doing IHE-based exchange and then work toward FHIR-based exchange. All right, next slide. Okay, so one of the things that's required with the implementation of TEFCA is as a directory service to support the exchange of information between and among the QHINs participants and sub-participants as mentioned. And the directory service is something that's in process now with the QHINs that are applicant QHINs that are onboarding. They're actually testing, utilizing the existing directory service now. Next slide. All right, so I wanted to jump to the exchange purposes under TEFCA and how do they work. All right, so there are several exchange purposes, permitted exchange purposes to the right of the screen, as you can see. And one of those, obviously, is public health. and that's what we're focused here on today. But the others have been in process as well: treatment, payment, healthcare operations. Individual access services is an interesting one, and that's consumer access to their own data. So a little bit more about that is in the slide deck. I won't spend a whole lot of time on that today. But only these 6 exchange purposes are currently permitted under the common agreement. Let's see. And in the process of implementing these exchange purposes, we have created, or the RCE has created, those standard operating policies and procedures that Chantal mentioned earlier around treatment, payment, and healthcare operations. The public health SOP work stream has just kicked off, and I'll speak a little bit more to that in just a second. All right, so this is just a slide on the definitions of the exchange purposes. So treatment, payment, and healthcare operations. I want to focus on the public health exchange purpose and actually take a look at that a little bit more in depth. That includes requests for, uses of, and disclosures of information by public health authorities that are consistent with the HIPAA privacy rule and other applicable law. So that's a mouthful, and that is a lot to unpack there. And I'll speak a little bit more to this in just a second, but we've been working within Sequoia with a work group, separate from the public health work group that I mentioned earlier. But this was a work group that was looking at sort of an educational guide for public health as it pertains to TEFCA. And this piece definition here that I've just described, we spent a good deal of time on that particular public health exchange purpose, sort of discussing that and just sort of digging into what exactly that means. Just the term public health authorities, it is debatable in terms of there is a definition, obviously, in law around what public health authorities are. But that does extend to others that aren't within public health agencies or within public health government that do provide public health services that might be considered a public health authority. So a little bit more on that to come in just a minute, but that was an interesting component of the conversations we had with the work group working on the educational resource that I'll talk a little bit more in a second. And then these other definitions are certainly around the other exchange purposes, and they're there for you to read and let us know if you have questions on those. All right, as I mentioned, we have a couple of different ways that QHINs exchange information. There's query, responses, there's push. The request for treatment and individual access services are the first types of exchange purposes to which TEFCA entities are required to respond. So if you are a QHIN entity and you have participants and sub-participants exchanging data with you, the first, if you receive a query around treatment or individual access, again, that's the consumer access to their own data, then TEFCA entities are required to respond to those first. And there is a requirement to respond to those inquiries. The responses would not be required if the information is prohibited by applicable law, as we mentioned before, or by the common agreement. I'll just mention here that, and this is really important, that these entities are permitted but not required to respond to requests. So public health. So public health, you may query for information, and you may have information pushed to you via a QHIN as a participant or sub-participant. But if an entity queries a public health authority, you are not required to respond. And that's a really key piece of information, I think, to understand. And again, we spent quite a bit of time talking about that particular item within our educational guide work group around the fact that you are permitted to query and receive pushed information, but you are not required to respond. Okay, next slide. All right, so some examples of use cases that leverage the exchange purpose. Chantal, remind me when I pass back over, I'm supposed to pass back over to you.
After this section, but if you want me to do the treatment one, you could do the public health. How about that?
Yes, sounds great.
Okay. So these are some examples and just some provisos that these are only examples. So here's an example under treatment where there is a primary care provider who is sending a referral and they want to share information ahead of that referral appointment. So what the PCP does is they work with their local exchange entity, which in this case is a QHIN. They consult the directory to find the dermatologist that they want to send this care summary to, and that's it. The QHINs take care of it from there. So all the doctor has to do is connect into the RCE directory via their exchange partner, and the TEFCA exchange will take care of the rest of it, which of course then involves one QHIN working with another QHIN. But the idea is to really just simplify that exchange. So all the person who wants to share information needs to do is find the recipient in the directory. Here is a public health use case. Why don't I go ahead and walk through this, and Debbie, you can add commentary. So this is the idea that you're doing a case investigation and you need more information. And so again, you don't have to reach out specifically to a healthcare provider that you know has treated that patient. All you need to do is work with your health information exchange partner, in this case, QHIN A, to say, hey, you know, we have a positive lab result for this individual. We need more information about them. Who has information about this person? And then your exchange partner, in this case, QHIN A, will then take care of sending that query out to all of the other QHINs, who will then query all of their participants and sub-participants. And in the case here, for example, of Hospital B, they say, nope, we don't have anything about that patient. So that's the end of it for QHIN B. QHIN C, there's Hospital C that says, oh, yes, you know, that person was in our emergency department. Here's the information that we have. They'll send back their CDA document that will flow through this QHIN exchange back to the Public Health Authority. And then in this last row here, you have another connected public health authority who says, oh, that's interesting. We have a record. Let's just say the patient, well, I'm not quite sure, so I won't say, let's say they had COVID. And the public health authority says, oh, well, we have information that that person actually got their COVID vaccine, you know, 6 months ago. So they send that information back. So the idea is that it creates the opportunity for Public Health Authority 1 to have access to much more information than they normally would, without even necessarily needing to know who else treated the individual. So rather than having to kind of do an investigation where you figure out, well, I need to know more about this patient. I wonder who saw them. Let me go contact that facility. You can actually just query, and then through the QHIN to QHIN exchange, anyone who has data about that individual will send it back. So Debbie, I don't know if you want to add anything else to that.
Just to mention that the Public Health Authority itself is not required to respond, but in this particular instance, the Public Health Authority did respond with the 2 records back to the QHIN it's connected to, back to the QHIN that the original Public Health Authority initially queried from. And I would say, mention here, you might be thinking, well, how does when I'm querying for a particular patient, how does the QNA, how does that know that's the patient I'm actually querying for? So each QN is required as an applicant QN, and they are onboarding now, they're required to have a record locator service in order to, whether that's geographical, whether that's however they choose to do their RLS, their record locator service, so that they can do really accurate patient matching. So obviously that's important in how we expect results to come back for the patient that we're actually querying for. So just to mention that that's a really important functionality that a QHIN is bringing to the table.
Yeah, and just to add to that, TEFCA can't solve our lack of a unique patient identifier, but what it does do is set forward in the QTF the expectations for the scope of information and the format of demographic information so that we're getting closer to a single nationwide approach to patient matching that should, over time, create fewer errors in patient matching. So it's actually a pretty big benefit, really, of TEFCA. Is to move us closer and closer to a nationwide approach to patient matching. So I'm going to skip this example, but it is something like the Social Security Administration looking for medical records to confirm that an individual is eligible for disability benefits. And now we'll get to Debbie and considerations for public health.
Okay, thank you, Chantal. All right, I know we've got a question or two in the chat. We'll come back to those. I think we're just about at the end of the slide deck, and we'll come back to those in just a minute. Maybe we'll speed things up a little bit, but TEFCA and public health. So this is this slide just sort of describes what we've been doing in order to prepare for TEFCA and public health as a use case across the country. And as we mentioned, it is a use case defined within TEFCA. Goals are to provide more relevant and timely data. You can query for information, as we've mentioned. Does provide this common data sharing structure. And this is really interesting, I think, because I know I experienced this firsthand at the health department in Virginia, but typically when you're doing data exchange or data sharing with an entity, you do have the need for these data sharing agreements. And the common data sharing structure through the common agreement could potentially alleviate the need for those one-offs for data sharing agreements. Not necessarily going to solve the problem or the issue completely, but it could alleviate the need for the data sharing agreements, the one-to-one data sharing agreements. So we did form a work group of public health experts in early 2023. I think I mentioned this, to develop the Public Health TEFCA Educational Guide. And this group does include representatives from the Office of the National Coordinator, the ONC, as well as the CDC. So we've had a series of 6 work group meetings, and we collected feedback to draft an educational guide for public health that describes the exchange purpose and the use case, and how public health may participate in TEFCA. We did provide a draft to the broader public health audience throughout May and June, and collected quite a bit of feedback. We are looking to finalize the document, and I sort of qualify finalize the document and post it to Sequoia's website under the RCE page. But I do want to mention that the educational guide is really meant to be a living, flexible document, meaning that it will most likely be in draft form for quite some time as we receive additional feedback and sort of tweak the document here and there, depending on the feedback we receive from public health as they review the document going forward. Then a second work stream has been initiated to kick off the Public Health Exchange Purpose Implementation SOP, and that's for QHIN to QHIN exchange within TEFCA. That work is currently underway, and we expect to have a draft SOP for review by around the fall. Now, what's happening with this SOP currently is the QHINs, the applicant QHINs are meeting to come up with because this is QHIN to QHIN exchange. So this SOP discusses the technical components of exchanging data, public health data within a QHIN to QHIN. So we're starting off with sort of a draft that will be fall out of this work from the second work stream. And then that draft SOP will be put out to the public for additional feedback. And that is when it would be great for all of public health to kind of come together, take a look at that SOP and provide feedback. I think I think we will need to take a look at the two documents together because they are complementary of one another, the educational guide and the SOP. So some of the work that you might see in the educational guide, which is around sort of frequently asked questions, information about TEFCA and public health, definitions that might be pertinent to public health, but might not be within the common agreement. So you might see some differences there, but they are complementary to one another. So the educational guide would be really the document that would have the sort of specifics to public health in terms of TEFCA and definitions, et cetera. And then the SOP would really have the technical QHIN to QHIN exchange documentation that the QHINs really need in order to treat public health data appropriately. All right, we'll move on to the next slide. Okay, so this slide actually comes right from CDC and CMS and ONC actually, and these are sort of the thought process from CMS around and CDC around the public health exchange modalities and the actors who who might participate in this. So on the push side, data source to STILT, so there's electronic case reporting. I will mention that electronic case reporting has been implemented nationally across national networks, not necessarily being used as much as it could be, but it is a sort of a use case for public health within TEFCA. Test ordering, electronic test ordering and results, vital records. So vital records was around birth and death registration systems, for instance. Cancer registry, immunization registry was also one that was mentioned. And then a data source to the CDC would be around the national healthcare surveys that health departments are required to participate in. And then STILTs to CDC, that's mostly vital records. And then on the query side, you could query from STILT to STILT for case reporting. You may, there may be some, I'm not sure, I think there is some querying done between a STILT and a CDC, but seems to me that's more in sort of a TBD and there's more information needed there. And then query from provider to STILT, and then STILT to provider, case investigations for future planning or for, well, actually the case investigation is sort of a future use case, and then vital records again. So these were some of the push and query examples of use cases that actually the CDC and CMS put forward. All right.
All right. I see we have 5 minutes left. I'm going to very quickly, this is the timeline, and we've been working at this for a while. The exciting thing is that we do have a number of QHIN applicants who are actually working toward operationalizing exchange. So as Debbie said, there are 6 applicant QHINs whose applications have been accepted. They are going through the conformance testing process. They will then do some testing among each other, QHIN to QHIN testing. They'll go through cleaning up any items that needed to be completed from their application. For example, some entities were in the process of getting their cybersecurity accreditation, and that needs to be finalized. And then they will be designated. So there are no QHINs as of today. There are only applicant QHINs as of today, but they've made incredible progress in going through the application and testing process. And you may have seen in the news that there was an event in February convened by HHS with Secretary Becerra giving comments at that event. Those 6 QHINs that are in the testing phase now, all committed to be participating in live exchange among one another by the end of this year. So this is becoming real. I know you've heard about TEFCA for a while, but it is being stood up, which we think is pretty exciting. And so now really is a good time to figure out, hey, where do we fit in that QHIN landscape, that TEFCA landscape? So there are educational resources. We invite you to look at those, and we will go to Q&A.
Thank you. Brian, it looks like you have 2 questions in the chat. Do you want to go ahead and ask them?
Sure. Thank you for the presentation. It was really, really good to hear more about TEFCA. My 2 questions are related to the provider directory. Does TEFCA provider directory contain organizational endpoints like direct addresses or file servers and those kinds of things?
So the directory itself does contain organizational endpoints. So right now, remember, we're doing QHIN to QHIN testing at some point later this year in order to onboard QHINs completely by the end of the year. So the applicant QHINs at some point will be doing QHIN to QHIN exchange for testing. And in order to do that, the directory is already populated with the endpoints for those organizations. And as participants and sub-participants come on board, those endpoints are added to the directory.
Okay, so they're discoverable, and that way, yeah, that's awesome. Okay, last question. Will the healthcare directory be able to communicate with other like directories? I know that at one point last year, CMS proposed or had an RFI out about their own directory. Will the TEFCA directory be able to communicate with other like directories?
Not initially. The RCE TEFCA directory will initially be utilized just between QHIN to QHIN exchange. And as I think you're sort of referring to actually what happens with national networks now. So national networks maybe have participants or customers connected to a national network, and they are able to share information across networks. So eventually that will occur, but initially it will be QHIN to QHIN, and those organizational endpoints are the ones that would be in the directory.
Okay, thank you.
Of course.
Thanks for that. So we are actually at the top of the hour. So folks, please, if you need to drop, please do so. Do we have time for one more question with you? Natalie, if you're still on, do you want to go ahead and ask?
Yeah, hey, I'm still on. Good morning, everybody, and thank you for the presentation. It was really, really good. I'm just trying to gauge of the 8 QHINs that are in the process of onboarding, how many members are on these QHINs? Is it like how should I say this? How much uptake do we have at this moment with these QHINs? And then also, are some of the QHIN members government entities like Medicare or the Medicaid agencies? Or maybe Department of Health? I'm thinking that's too soon, but.
So QHINs are currently applicant QHINs. So we don't really know, I think, how many, what networks will need to do, or HIEs will need to do, or those who wish to participate in TEFCA will be to pick a QHIN. And you can only be a member of one QHIN. And I think that's something we will find out as we continue to move through the applicant QHIN process, onboarding process, as entities decide. And there are some HIEs and hospital systems and organizations across the country that have reached out to an applicant QHIN and said, you know, hey, I'm going to select you as my QHIN as we move forward. But I don't think we know how many there will be.
Okay, thanks.
Well, I think that's the last question in the chat. Thank you both for taking the time, for your willingness, and for taking the time today to join us. Really appreciate it. As you may know, Tennessee does not have a statewide HIE, unfortunately. We do have one pretty active, more local regional HIE out in East Tennessee. I think there might be some interest in possibly exploring or thinking about statewide HIE in Tennessee, but obviously that would take some time to get there. Regardless, I think we're still very much interested in the potential opportunities that TEFCA has and can afford public health. So as much as we can stay engaged and be informed and participate where we can, we definitely want to do so. Thank you again. I really appreciate your time, and I hope that we will have some, probably some of us are probably going to be looking to get engaged with some of the public health work groups where possible. So thank you so much.
Thank you all for having us today. We appreciate it.
Absolutely. Have a great day, everyone.
Thank you.
Thank you.
Take care.
Bye-bye.
Bye-bye.
Bye.